So I'm Mickey Babicki. I am a surgical oncologist and hepatobiliary surgeon with the Center for Advanced Surgery at the Oregon Clinic. I'm also the program director for Hepatobiliary Fellowship. We want to produce high quality, minimally invasive hepatobiliary surgeons who are autonomous and confident in their abilities to do complex HPB surgery. I think the strengths of the fellowship are the autonomy we give the fellows. I think that's a critical component of any fellowship training program, and really giving you the confidence and the maturity to be able to manage complex situations in the operating room and do it gracefully. The other strength is just our team. I think we all manage patients similarly, we get along really well, and we have just a wide variety of resources available that really round out the experience of the fellows, that it's not just the HPB surgeons, but the strength of our group as a whole. That's really a special quality. Exciting times here at PPMC. I think the most pressing thing on my mind is we're getting ready to launch our hepatic artery infusion pump program. Have 2 patients lined up next month to start that program. It's been about 2.5 years in the making. And we have several patients lined up. It's going to be a really exciting time. Also expanding our robot access and broadening the depth of our minimally invasive experience, using some new tools and toys in the operating room, and really getting the fellows in there with more MIS experience. To make it in this program, you've got to be really independent. We lean on the fellows pretty hard to manage the service, manage the patients, and really run the service from day one when you get here. So somebody who's confident and independent, likes being busy. We operate a lot. We're a real high volume center, and so somebody who likes to be in the operating room a lot. And just really a commitment to teamwork and working hard alongside with us to take good care of the patients.
My name is John Gary. I'm a hepatobiliary pancreas surgeon. It carries a strong legacy forward into the future that was established by Lee Swanstrom and Paul Hansen. And Paul Hansen was a world-renowned minimally invasive hepatobiliary and pancreas surgeon. And he was the program director and developed this program from the beginning. I had the pleasure of being one of his fellows and carrying that legacy forward with our efforts in minimally invasive hepatobiliary surgery, doing minimally invasive Whipples and hepatectomies, is one of the big strengths of this program.
Well, I think that robotics is here to stay, and I think that it is an essential part of any young HPB surgeon's training. That's what we're trying to do with our fellows, is get them on the console, doing cases independently, so that their first 5 years in practice, they're ready to hit the road. Fellows are going to come out of this program ready to be an independent HPB surgeon. You're part of a cancer center, and so you're going to get great multidisciplinary training for complex cancer care, but we're also a tertiary referral center for all the benign biliopancreatic issues, bile duct injuries, complex pancreatitis, decision making on EUS cysgastrostomies versus surgical necrosectomies and debridements. You are going to come out ready to handle and manage any patient with liver, pancreas, bile duct problems.
As the associate program director of this fellowship program, we are looking for the right fit. We're looking for a candidate that has a clinical acumen that is strong. We're looking for a personality type that is tenacious, but also easygoing and fun to work with. We're looking for a surgeon who has technical independence in the operating room. someone that we can take from being an outstanding resident to an outstanding hepatobiliary surgeon. So we expect nothing less from our fellows than the absolute best they can provide us. And we do so in an environment that is conducive to learning, that is not of a style that fellows might find intimidating at all. And we're very encouraging as faculty in this program. We want you to succeed beyond your own expectations, and we will push you to that point.
My name is Anusha. I did my residency in Phoenix, Arizona at Maricopa, and then I did a transplant surgery fellowship at MGH in Boston, and now I'm here as the first year HPB Fellow at Portland, Providence. Autonomy, collegiality, and just overall fun experience. As a first year fellow, you round on the service, go to cases, you get to choose what cases to do. So a typical day would be rounding in the morning, doing cases, and then kind of touching base with your attendings, and then you're on call overnight as well. We do a mixture of both maximally and minimally invasive liver, pancreas, and biliary cases, so you get a pretty comprehensive foundation of the right upper quadrant.
Yeah, so I'm Jared Forster. I'm a second-year fellow here at Portland, Providence. I did my residency at Stanford and came up to Portland because of the history of all the minimally invasive HPB surgery. I think my favorite part about the program is the people. Out of all my years of training, I think this has been the most fun that I've had within all my surgical training. As well, that kind of open to new ideas and trying to learn and push the envelope in terms of new techniques to dealing with both benign and malignant diseases in the right upper quadrant. The second year experience is great. It gives me time to do some reading, to be able to understand kind of the next transition to being an attending, to doing some research, and then also to being able to do some minimally invasive surgery, especially doing some laparoscopic Whipples with Dr. Gary. I think kind of the unique thing about the second year experience, and kind of one of the reasons it drew me, was that there's not one set experience. If you have interest in a certain topic, there is opportunity to pursue that. Here at Portland Providence, there's a really good experience within especially benign and malignant, so dealing with a lot of crazy pancreatitis, biliary problems, but also malignancy. One of the weaknesses is some of the vascular reconstructions and transplant, but that's the great thing about having a crosstown program that's collegial. I spent some time at on the transplant service at OHSU to be able to get those skills that I wanted. In terms of the normal day-to-day second year experience, it's pretty chill. Anusha takes all the pages, and I just get offered on occasion. No, I'll change the answer. I'll change that part of the answer.
Why should you come to Portland?
Yeah.
I love Portland. I had never lived here before I moved here, going on 5 years ago. The people here are amazing. They're a little quirky, but I love that about it. It's very unique. It's very welcoming. It's very family friendly. There's a lot of really neat neighborhoods in Portland where things are thriving and really coming back after the pandemic, and so I love it here. There's a ton to do. There's beer, there's food, there's mountains, there's beaches, there's everything you could ask for, and it's a really amazing place to live.
What I love about Portland are all the neighborhoods and the walkability. You can go from where you live to a great coffee shop or bar. There's always good food or drink close by.
Portland's pretty sweet. There is an incredible amount of outdoor stuff. If you're into skiing or snowboarding or winter sports, Mount Hood is like an hour and a half away. Really easy to do on the weekends. And there's a lot of great beer and food in town. If you have a dog, it's a perfect town for you to come spend 2 years and learn from these guys.